Do you know gonorrhea is the second most common infection caused by bacteria, and it can be passed from mother to child during birth? In this particular video, I'll be discussing with you what gonorrhea is, the causes of gonorrhea, the symptoms of gonorrhea in both men and women, and how to prevent contacting gonorrhea. Hi, welcome to my channel, Med-Xposé. My name is Nurse Amarachiku Okunobi, and in Med-Xposé, I preach the gospel of sexuality, sexual health, and reproductive health. If these are content you love to see often on your screen, please press the subscribe button and turn on the notification bell to get notifications of my subsequent videos. Now let's go back to the matter of the day. Gonorrhea. Gonorrhea is a common sexually transmitted infection caused by a bacteria known as Neisseria gonorrhea. It can also be called the clap or the drip. Now, how is gonorrhea spread? Gonorrhea is spread through sexual fluids, semen, vaginal fluids, during intercourse, anal sex, oral sex, or even sharing sexual toys with an infected person. Who then gets gonorrhea? Anyone who is sexually active is open or is predisposed to getting gonorrhea. Now, aside from being sexually active, a mother can also transfer this gonorrhea from herself to the baby at birth. Now, let's talk about the symptoms of gonorrhea. Oftentimes, gonorrhea do not present any symptoms, especially in people assigned female at birth. Yes, people assigned female at birth, sometimes they do not present with the symptoms of gonorrhea. But regardless, there are still some people who present these symptoms. And these symptoms in women include unusual vaginal discharge, bleeding between periods, pain during intercourse, pain or burning sensation during urination, and pain in just below the abdomen or the belly button. So if you're having these sensations, if you're having these symptoms as a lady, please go and check yourself for gonorrhea. Go for diagnosis, go and meet your medical doctor, go and meet your medical practitioner, go for investigations to be sure that you're not having this bacteria called Neisseria gonorrhea or you're not having the infection gonorrhea. Because if you have it, you can easily transfer it to your partner. Now, the symptoms in men include pain or burning sensation during urination, testicular pain, or even swollen testes. You can also have whitish discharge or yellowish discharge from the penis. So if you're having these things that I'm mentioning, please go for checkup. Now, yes, generally, gonorrhea symptoms in both male and female. These are some of the symptoms. You may have trouble swallowing, you may have itchy feeling, you may have sore throat, you may have pain or discharge from the anus. So when you see these things now I've mentioned, I know I listed the one of male, that are distinctive for male, the ones that are distinctive for female, and the one that is common for both male and female. So when you see any of these things, please go for checkup to know if you have gonorrhea and start. Earlier, I've given us what causes gonorrhea and how it can be spread. Now, I want to tell us what doesn't lead to gonorrhea or what doesn't predispose us to gonorrhea. Now, when you kiss somebody, when you hug somebody who has gonorrhea, it cannot be transferred through that means. When you hold hands with a person, it cannot be transferred through that means. When you share food or drinks, when you use the same toilet, when you inhale droplets, you cannot get gonorrhea from there. Gonorrhea is basically spread or is basically gotten by body fluids. There must be a contact with the fluid. It is in that fluid that causes or that transfers the bacteria from this person to the other person. Now, how do you prevent? How do you keep yourself safe? How do you prevent yourself from getting this gonorrhea? If you're having sexual intercourse, please protect yourself. Use a dental dam or get a condom. Do not feel that this particular person is safe. She doesn't have gonorrhea. He doesn't have gonorrhea. Don't risk it. If you're not sure of your partner, please use a condom. And do not have sexual intercourse with someone who already has an infection, even if it's not gonorrhea. Because some of these infections sometimes predispose you to having gonorrhea. So the person may actually be incubating that bacteria, Neisseria gonorrhea, that causes gonorrhea in the human body, and you may not know. So when you have intercourse with someone who already has an underlying infection, it will predispose you to having gonorrhea. And do not have sexual intercourse with someone who already is established to have gonorrhea. Let your partner get treated first before sexual intercourse. And limit your sexual partner. Like I always say, have one sexual partner at a time. So you don't keep transferring infection from one person to other. Have one sexual partner at a time. And learn to communicate these things to your partner. If you're actually treating infection, please communicate with your partner. And of course, get tested if you have any of these symptoms to prevent it from getting disastrous, to prevent it from getting complicated. Please get tested. The complications differs in male and female, and the treatment also differs. Don't feel that I have gonorrhea. You go to the pharmacy, you procure drugs, and you give yourself. No. Yes, gonorrhea can be treated with drugs. In fact, gonorrhea is treated with drugs, but don't prescribe yourself. Avoid self-medication because you may end up taking the wrong drug, thinking you are helping yourself. So when you've been diagnosed of gonorrhea, please take prescribed drugs. Ask your medical doctor, ask your medical practitioner, ask your pharmacist to prescribe the drug for you. Don't just walk into a pharmacy and take any drug because you want to treat gonorrhea. And if you have any symptom at all that is related to sexually transmitted infection, please rush to the hospital. Any of the sexually transmitted infection can be dangerous to your reproductive health. I hope you find this video valuable. And if you do, please drop in the comment section. Thank you for watching this video to the end. Don't forget to like, don't forget to share with your friends, and don't forget to subscribe to my channel and leave the notification button on. To all my returning subscribers, thank you so much for staying with me. See you in my next video. Bye.